Dolores Claiborne. That's what. I thought like the mother-daughter relationship was very something to talk about.
So what did you observe? Not worrying about any diagnoses or clinical, terminology per se, but what behavior was interesting to you?
There's a lot of like mistrust.
Mistrust.
I thought it was interesting how they remembered the past very differently.
They did. Any thoughts as to why they may have different recollections of the same past?
Well, it seems like there was a trauma that happened.
Right.
So it seems like because of like a lot of times when you have trauma, your mind does like this protective factor of forgetting things or changing things so that you don't have to keep reliving that. And then so I think that is some of what in both of the cases kind of warped the past.
Yeah, and especially with Selena.
Yeah.
I think it's reasonable to assume, upon discovery that she suffered from sexual trauma, that during the traumatic event, that she dissociated. And when in that dissociative state, that's a function of the hypothalamus. Individuals will not integrate new information. They instead become hypervigilant about the imminent threat. They don't process the information, which means that days later, weeks to years later, they're going to have a form of dissociative amnesia. Mm-hmm. So it's fairly straightforward, and I think reasonable to understand why Selena doesn't recall what she does.
Right.
Any thoughts about why Dolores doesn't, or her recall is different?
I thought Dolores' recall was pretty much accurate to what was depicted to be the truth.
Mm-hmm.
Mm-hmm.
So I don't think she's employing like defense mechanisms per se that warp her memory.
She's also like our narrator, so I guess in a way it was kind of unclear, like if that matches up with the truth, like how reliable she is.
Mm-hmm. Mm-hmm. But when is it revealed? When does Dolores realize that sexual trauma occurred? Did she know from these stories beginning?
No.
Well, she, like, her in the present knew, but her, like, flashbacks, her past did not know. She sort of realized it when she saw that her daughter had that necklace.
The necklace.
Right. So in that context, there may have been an element of denial early on, that she wasn't able to see what was right in front of her.
Mm-hmm.
Right.
So there may have been an element. That's something to consider here. Dissociation, denial may be playing a role. Dissociation is a physiologic response, albeit also a defense mechanism.
Right.
Denial is a defense mechanism.
Mm-hmm.
It's a function of our subconscious, specifically that subconscious component called the ego. Right? And it's a way in which we alleviate anxiety. We alleviate that conflict between what we know and understand, our id impulse, versus what societal's prohibitions are.
I also wonder if she sort of assumed that that Selena was being abused by the father before she had any actual proof. She was sort of just going off of a hunch, and based off of that hunch, she kind of sort of killed him or didn't save him. So I wonder if that was almost a delusion. It turned out to be the truth, but she didn't know that. She was sort of guesstimating.
That's an interesting take, but when you say it turned out to be the truth, we also have to recall, pardon the pun, that Dolores is the narrator.
Right.
So
but that point where it turned out to be the truth, that was a flashback that Selena had.
Yeah, there was a shift in narration towards the end of the movie.
Mm-hmm. Yeah. So, something to consider. Absolutely something to consider. Dolores or Selena, which character do you want to begin to discuss in more detail first?
Selena.
Selena?
Yeah.
Right. So what else did you observe in Selena?
Substance use.
Right. So substance use, so addiction. I think that is a subversive statement, which Stephen King has no problem doing, towards the medical field, that you have a patient here, you have a victim that is self-medicating. So fill in the blanks. She's not being cared for in an appropriate treatment planned way. Right, so certainly addiction is here. What substances are you concerned about?
Alcohol.
Alcohol.
And there's many other medication that we see, but we don't get like the names of them.
Yeah, I want to get to that in a second as
Yeah.
well. Alcohol makes a ton of sense here. That is, alcohol is a CNS depressant. So if there is an anxiety, if there's significant anxiety, or if there's a diagnosable anxiety disorder, then the idea that she's self-medicated with alcohol is consistent with the known physiology of how alcohol works. What additional substances would be high on your list here? Benzodiazepines.
For
Absolutely.
anxiety also.
Anything else?
Maybe like stimulants, because she has this high functioning job where she has to like go to work and like.
So the use of stimulants can certainly not off the table. I would suggest that it is a way to take the edge off her self-medicating with the alcohol and or benzo. So I don't know if she'd actually be self-medicating with it, but it might be a way for her to actually counteract the quote-unquote side effects of the alcohol. That certainly could happen. But any other medications or medication class that might be high on your list when it comes to self-medicating anxiety?
Well, I don't know.
Yeah, opioids are the
Because she seems like she's kind of like trying to like numb all of her emotions and like just put herself in like this state of like euphoria.
Yeah.
So she could function as like a person in society.
That's right. And the self-medication will occur when her body's own defense mechanisms fail, right? So there's a form of self-numbing that occurs. However, when anxiety overrides that internal mechanism, then externally you reach for the pill bottle or the drug, right? So in that case, the opioids and alcohol, benzodiazepines, sedative hypnotics are going to be at the very top of your list there. So when you're prescribing these medications, you're going to be very careful because of the high risk for self-medication and abuse.
Right.
Let's say the opposite occurs. Let's say that her internal numbing mechanism works too well. How might she present to your clinical practice? And what might you do to counteract that?
She would probably be like have some depression or just like blunted affect.
And what might she do to quote unquote self-medicate that?
Stimulants.
So we're looking at drugs with the opposite mechanism of action, stimulants with the top of our list. What else? How do people present to emergency rooms?
Cocaine. No, I don't think that's what you're going for, but.
Like catatonic.
No, cutting.
Oh.
Cutting roots them. Right? Cutting gets them out of that numbing. They cut. What's happening is that the individual is having an endogenous opioid response that is misamplified, hence the numbing, which is part of post-traumatic stress disorder. And to overcome that opioid response, they could cut, right? Or they can engage in non-suicidal, self-harmful behavior. If you identify this in clinical practice, what is a medication you may consider prescribing in addition to psychotherapy?
SSRI.
An opioid antagonist, right? Because it's your endogenous opioids that are causing this numbing. So the prescription of the trade name, the brand name, is Revia, and it's naltrexone.
So you would give that, but not because she has opioid use.
Correct.
She has like
I'm more worried
endogenous
about-
opioid.
Exactly right.
Overdose.
Oh, I didn't know that.
Yeah.
Interesting.
Right, so the combination
Yeah, I didn't
of
know that.
psychotherapy, psychosocial therapy, CBT, you have your pick, but the biological therapies, the somatic therapies, the medications that might be on board here would include perhaps naltrexone to blunt that endogenous opioid surge that results in the numbing, therefore You engage in adaptive forms to overcome the maladaptive cutting. What else for Selena? We're not going to be shocked if she has co-occurring major depressive disorder.
Yeah.
A matter of fact, it looks like it might be so chronic that it might actually be what was formerly known as dysthymic disorder, right, which is persistent depressive disorder now. Right?
I think also like a PTSD picture for her, just like the depersonalization, derealization, repressed memories,
Flashbacks.
And also like her, like sleeping with the guy that she works with to like almost like get more papers, but like then when he wasn't interested, she felt like she was worthless. Kind of like almost like supports for me the fact that she was abused as a child. Like I wouldn't call it borderline, but I would call it like almost a form of like something going in that direction.
Yeah, I mean,
Yeah.
her paternal father figure was sexualized.
Right.
So her having an affair with her boss, a maladaptive affair with her boss, is rooted in an early sexual trauma.
Right.
It is. And I wouldn't discount borderline personality here. Now, borderline personality is a freestanding illness. You could look it up in the DSM under the personality disorders chapter, no doubt about that. And I want to talk a little bit about that as well. But borderline is also thought to be the personality disorder that is the manifestation of post-traumatic stress. So an individual is traumatized. As a result, they can have maladaptive anxiety, and that might be diagnosed as PTSD.
Okay.
Nobody would be
Right.
baffled by that. Similarly, with early childhood trauma, especially sexual trauma, the trauma results in a personality change. And the personality change is very reliable. It's very consistent when it comes to signs and symptoms. So consistent that we put them together in a criteria set and label that borderline personality. So, you know, from one perspective, we can look and say there's a significantly high comorbidity between PTSD and borderline personality, especially when the trauma was early childhood sexual trauma. The other perspective is to say that PTSD, borderline act on a continuum, and it's a matter of perspective. One is an anxiety state. The other is the personality change that results from the anxiety state, or along with that anxiety state. So nobody's going to be surprised when there's that high level of comorbidity. And in this particular case, Selena does manifest borderline traits. She definitely does.
She also manifests a lot of like the immature defense mechanisms or whatever it's called, like in terms of like her remembering different things in her past versus like what actually happened, or like so much like repression, and I feel like the list just goes on.
It does.
Yeah.
It does. And it's good that you bring that up because we mentioned this before, but it's worth reviewing. In a week, when you take your shelf exam, you are going to have a clinical vignette for which a personality disorder is your single best diagnosis. And for the majority of them, all you need to do is remember that single cardinal trait that allows you to rule in the schizoid personality, the schizotypal or typal personality, etc. So please look up what the DSM says is that cardinal trait, because then when you review the actual diagnostic criteria, you'll see that they're just examples of that cardinal trait, and it makes learning these conditions incredibly easy. The exception here is borderline personality. If you read the definition closely, there is not a cardinal trait. It is not like antisocial, histrionic, or narcissistic, the other cluster B personality disorders. So for borderline personality, you kind of have to review those DSM criteria as criteria instead of examples. And you may have to commit more to memory. Now, the good news, though, is that if you remember the characteristic defense mechanisms, they link directly to some of those diagnostic criteria. And then we can also see if Selena actually demonstrates them or not. So give me a defense mechanism that is characteristic of borderline and therefore likely to show up on a shelf exam. Splitting, right? And what is the diagnostic criteria that results from splitting?
Quick changes in mood.
Exactly. Mood lability, mood reactivity is a diagnostic criterion of borderline that is directly linked to splitting. Evident in Selena or no? Yes. Okay, good. Any other?
There's one that I can't remember what it's called. It's like when you take a thought and it's like a socially unacceptable way to think, and then there's like the mature one where you turn it into like something socially acceptable. And I think, like,
Sublimation?
yeah.
So sublimation is exactly that. You take an impulse and you allow for the artistic expression of that impulse. So she's a book editor?
She wants
She's
to
a
be. She's a
mag-
journalist
A
or
journalist.
something, but that was her goal that she was working
Well, even better yet. I mean, if as a journalist, if she actually writes a novella or a short story about someone who is sexually traumatized, it's a way for her to actually express her conflict, her id impulse. And perhaps even in that book, this fictional character in this novella, murders her father and gets revenge. The superego will not allow that thought to come to her conscious awareness.
Mm-hmm.
Daughters are not allowed to think about killing their fathers. So the superego is going to thwart that. However, she could still get it expressed. She could still cachex or discharge that emotion, that id impulse, through sublimation by creating a character that kills their father/creator. Right? Who did that, by the way? That's not familiar.
Isn't that?
Who wanted to kill her father and created arguably the best novel ever?
CABnormal.
Well, yes, but no. Mary Shelley's Frankenstein. Shelley hated her father. Right? When he got remarried, the old stepmother did not get along and felt that her father abandoned her. And it's no coincidence that Victor abandons his creation. And that monster, and Shelley thought herself as a monster. Tracks that SOB down through the continent of Europe all the way up to the North Pole and gets him. Mary Shelley had some issues. She also was the most artistic author to ever grace this earth. Sublimation. Sublimation, unfortunately, does not appear in the diagnostic criteria in any way
Right.
in borderline personalities. That is not one that is linked to a DSM criteria. Passive aggression. What's passive aggression? In Freudian terminology, not the way it's socially used. Passive aggression is the inward turning of a nihilistic impulse. Right? So in this case, if Selena wants to kill her father, she'll turn that violent intent inward, and it may result in a suicide attempt. So suicidal gestures are part of the DSM criteria. Borderline personality, suicide gestures are thought to be the direct result of sublimation or the maladaptive use of sublimation as a defense. Right? Does that happen here? Does she have a history of suicide attempt?
I don't think so. Did she?
I almost remember her mom like seeing something on her arms and saying, "What is that?" But I could totally be making that up.
Yeah, I thought it was. I don't think it's overt,
Yeah.
but I think there's text here that suggests that there was a history of suicide attempt. And I might be taking that from the book, so I might be getting the two confused.
Oh, there's a girl.
So quite possibly here.
Yeah. Mom
and
also
again,
asks her like, "Well, do I need to worry about you again?"
Yeah.
again, yeah.
Yeah.
So I think it's there. The other defense mechanism that's characteristic here is dissociation, right? But here we're talking about dissociation as a defense, and that is that there is a rapid but temporary change in affect from an unpleasant mood state to a more pleasant one, right? So people come in to a situation and there's an unpleasant mood state, whatever that might be, shame, guilt, whatever, and there's a rapid, albeit temporary change where they have and they come off as being an over-the-top dramatic, or having an over-the-top dramatic affect. Of course, this is also shared with histrionic personality as well. Right? Selena? I didn't quite appreciate that.
Yeah.
But if you remember those three characteristic defense mechanisms that help define borderline personality disorder, you have three criteria that are likely to show up on an exam where borderline would be your single best answer. All right. Anything else with Selena? So what about this polypharmacy? A lot of medications there. Anybody count? Nobody, anybody nerd out?
It was like, I don't know.
Like 5 or 6, I
Yeah.
feel like I saw.
There was like 2, and then like she took more out, and then she was like looking for more. And it was like 2, and then 3, and then more.
So there's,
I remember like there was
Many.
1 and then another set. And I was trying to read the labels, but I couldn't.
Me too, I tried to pause
I
it.
paused it. It didn't. Yeah.
so there's a couple of things I think we should discuss by that observation. You're a physician accepting the transfer of this patient, and you just see her medication reconciliation record. What might come to mind? I think there's 2 things that should be at the top of our list to discuss.
Check the thing.
Database.
The
Yeah, right,
database.
okay.
Yeah.
You do. You may or may not find that she's got multiple prescribers. Let's say though, in this situation, hypothetically here, she doesn't. It's a single prescriber.
Substance use disorder, where she's like getting it from outside sources.
She could, but checking the database, you confirm that it's a single source.
And that provider is like giving her all of them.
Yeah.
And she's sleeping with them. That's what
I
I'm
think
concerned.
Possibly.
I'd be concerned about respiratory depression.
Yes, I would be. Yeah. How about from the providers? I mean, you're the new
Like
provider.
I want to know like what the diagnoses like. Yeah.
Right.
Like what are her like? Why is she on all these medications?
And and that's exactly what you do. And the answer is she carries diagnoses of obsessive compulsive disorder, panic disorder, and major depressive disorder.
Those can all be treated with 1 medication. So why is she on 10
Those could also
medications?
all look like PTSD.
Which is also treated by the same medication. So.
That's definitely one way of looking at this, right? That's one of the ways, again, more of a clinical pearl, but do
Only that
not be
one.
caught off guard if that's the way PTSD presents on your shelf exam,
Okay.
right? Intrusive thoughts could be misinterpreted as obsessions,
Mm.
and the individual with too quick an evaluation may end up being discharged from that office with OCD.
I see.
Right? Physiologic reactivity can easily be misinterpreted as panic, and therefore panic disorder. Right? The signs of anhedonia, impaired concentration, insomnia, and irritability can easily be misinterpreted as a major depressive episode. And then finally, hypervigilance can easily be misinterpreted as paranoia. So you may have a psychotic disorder on top of it. Right? So be very careful. With OCD and panic, you can get benzodiazepines, SSRIs. With depression, especially treatment-resistant depression, you can certainly get SSRIs and other classes of antidepressants. And with suggestive paranoia, you can get antipsychotics. So
Right.
that begins to explain why she may be not only so many medications, but so many classes of medications.
Mm-hmm.
Right. There's another reason too. Let's say that that's not true. Let's say that she is not carrying these multiple diagnoses of unspecified psychotic disorder, major depression, OCD, and panic, but instead has PTSD as her diagnosis and borderline personality also diagnosed, which really would not stun us. All these medications, now what's going on?
Is she like manipulating her doctor?
Sorry?
Is she manipulating the physician?
She might be, but let's say she's even if she is, the doctor, the practicing psychiatrist should be all over that.
Like, why is she on all these medications if that's...
Maybe
Be-
each time they give one, it's not enough, so they give more.
You're exactly, talk more.
Well,
Tell me more.
She tried one, so it didn't work, went back, so they gave her another one to try,
yeah.
and then she went back, and they gave her another one, and like she has them all now.
So maybe she was started an SSRI for the PTSD, right? The way medication management works for personality disorders in general and borderline in particular is that it's merely prescribed for symptom resolution.
Right.
Person comes in and they're dysphoric, you titrate the SSRI. Patient comes in and they're hypervigilant, you put a small dose antipsychotic. Patient comes in with chief complaint C, you medicate that. What must also happen in this treatment plan is twofold. Number one is when you adjust medications with the new onset symptom, you do your best to then wean them off the others.
Mhm.
So they don't end up a year later, 5 years later, on this level of polypharmacy. So symptomatic relief occurs. And it occurs in standard practice when the individual provided informed consent, including the off-label use of these medications. That's not a problem. The problem is when you don't stop them, and because the symptoms are no longer the object or the focus of your clinical attention. So that's the part that's problematic. The second part of all this, again, always thinking biopsychosocially, is that when you're doing this symptomatic relief, the long-term plan of addressing the symptoms is DBT, right? Biopsychosocial. Make sure that DBT, again, your shelf exam, the only psychotherapy that has been empirically proven to reduce adverse outcomes in borderline personality, has to be part of that treatment plan, has to be central to that treatment plan. So that's something to consider here as well. Anything else with Selena? I think it's interesting that the climax of this movie takes place with the solar eclipse. It's a thing of Stephen King's. It's very symbolic. And similarly, the summer solstice happens to be the setting for The Shining, another Stephen King film as well. So there might be something to that symbolism too. And believe it or not, it somehow connects to The Little Shop of Horrors. Not for discussion right now. Dolores.
Definitely PTSD as well. She's had flashbacks like throughout the movie.
Yeah. Right, and one of the internal processes that might alleviate that anxiety, perhaps, is denial, in terms of what she's willing to admit to herself that her husband is doing to her daughter. Anything else?
She's also like living in this town where like people think of her kind of poorly, like she has this bad reputation, and she's kind of like suspicious and defensive of everyone around her.
Go with that. I think there's something to be said here. If Dolores presented to you with a chief complaint that contained everything now we know after having watched this film.
Is she like paranoid? Because that's her perception of how the town perceives her.
And that's always something we have to consider here is what perspective we're willing to take here. So there might be an element of paranoia here, right? Hypervigilance, PTSD, it might be. The other thing I want to briefly mention with this character might be the theme of resilience. I think there's enough here, as a psychiatrist, and perhaps follow-up psychotherapy, this character, this mother, elects to go a particular way with her life to ensure that her daughter can make it. And she chooses to do that, knowing that part of the plan will be that her daughter hates her. And she accepts that. I mean, this is the quintessential mother here. And so, as we're pathologizing what might be going on with her, I think we have to keep in mind that she made some conscious decisions to ensure that Selena has a life in Manhattan that is her own, and a level of sacrifice that Dolores will endure to ensure that is absolutely the thing stories are made of. Right? So that's something to keep in mind here, as again we're discussing illnesses. Any other thoughts on Dolores? The last person I want to discuss today is Vera. What do you think about the character of Vera?
Is that the rich lady?
Yeah.
Oh.
She's like
I loved her.
very like calculated, like
like OCD.
very
where
OCD.
she is.
Yeah.
Oh my goodness. Maybe like depression or a mood disorder secondary to an underlying medical condition. Like she's dying and so she tried to commit suicide.
Or even like vascular dementia from
Yeah.
years of strokes, whatever it possibly
Yeah, so we know, let's talk about her medical conditions for a second. How much do we know about what is medically going on with Vera?
I don't remember.
Not really much.
Except that a doctor comes to visit once a month.
Yeah.
She says that she's dying.
Yeah.
There's definitely something like neurocognitive.
Do you think she attempted suicide?
Do you think she attempted? Yeah,
Yeah.
definitely. Didn't show.
Well, I mean, we don't know if
Do you think
what,
she actually
like, we're only getting one side of the story. We're only getting,
I
Like-
like what you're saying.
yeah. Like, do we, yeah.
I think so.
I think so too.
So-
I think she has antisocial personality.
Well, yeah.
Killing her husband and like then telling Dolores to go kill her husband. It's like that's a good idea, you know?
Yeah.
And like, be so casual about it.
That was so
And
funny.
just like her like scrupulousness in her house.
And being very charming and like always like perfect.
Yeah.
There's definitely an element of obsessive compulsive personality, right? Control and order,
Yeah.
right? Type A personality. Antisocial, obsessive compulsive personality.
But I think that could also like play into antisocial if the reason for the control is to like
Cover up.
right.
Yeah, well, a lot of serial killers who
Right.
clearly have antisocial personality also have obsessive compulsive personality,
Right, it's like-
ensuring that the FBI is not going to catch
Like
them.
Dexter's character
Dexter's
reminds me of that.
incredibly OCD.
Yeah.
The OCPD also makes sense because now that she's sort of like falling apart at the end, she can no longer like be that type A person, and like that could be causing her the distress that causes the suicide attempt.
So let's say that the reality is that she did attempt and she did commit suicide. What might your reflection be on her pre-existing diagnosis of major neurocognitive disorder? Right? Let's say that we believe this is dementia, and now it's status post suicide attempt. In addition to suicidality being part of neurocognitive decline, is there another consideration you'd make here?
She seemed kind of like scared of something, or like she was like, I can't remember what she said, but she was like, I can't take this anymore. So maybe there was like an element of like, she was like hallucinating things or seeing things or hearing things that were scaring her.
So a syndrome of dementia-related psychosis, right? And if we think that her neurocognitive decline, her dementia, is due to vascular etiology, very often psychiatrists prescribe atypical antipsychotics for dementia-related psychosis, but there's a black box warning. No. Stroke, right? Which could, of course, with subthreshold TIA, can even worsen her cognitive decline. So that might be going on here. The other thing to consider is that the suicide actually might be due to depression.
Mhm.
And depression manifests in the elderly can
Can be
look
like that pseudo dementia.
Exactly right.
Yeah.
So maybe this is a case of pseudo-dementia.
Mm.
So there's two ways of looking at this case. Dementia, perhaps a vascular etiology, made worse with the prescribing of the atypical antipsychotic and for dementia-related psychosis, and worsening stroke syndrome. Or if this wasn't dementia at all,
It's just depression.
and it's depression, aka pseudo-dementia, maybe the suicide attempt is a direct result of worsening depression.
Right.
So that's a
You could
consideration.
take it both ways.
Yeah, I'm not even sure which way to take it.
Yeah.
I want to go with the depression. I want to say that this was pseudo-dementia and not depression. And that this suicide attempt was as a result of that. Does that at all, or is that all at all supported by the plot? And specifically her relationship to Dolores. So what do we know about Eric Erickson?
Who?
I love it. That is an honest answer. Eric Erickson.
The stages of
Oh. I was
yeah.
like,
At first I was like, who was that?
So a psychologist who is absolutely fair game on a shelf exam that proposed personality theory differing from Freud's in a couple of major aspects, Freud, dynamic therapy, dynamic theory, where Erik Erikson was psychosocial, right? Freud believed that we are who we are by adolescence, and we're nothing more 10 years later, 30 years later, 40 years later, by other than just bigger and different fat distribution. They're the same person. Erik Erikson, personality development through the life cycle.
Right.
And with that, the 8 stages.
Right.
His publication, The 8 Stages of Man. Right? 100% adaptable to women too now. Right? No doubt. Like Vera. Now, what was his favorite color? Erik Erikson. Guesses, of course.
Yellow.
Yellow. Incorrect.
Gray.
Gray. Incorrect. Erik Erikson's favorite color.
Oh, blue.
Blue. Incorrect.
Black.
Black. Incorrect.
White.
White. Incorrect.
Purple. Purple.
Purple is incorrect. Correct answer.
Beige.
It's a good job by you. Now, Erik Erikson was a poor speller. Good news is that BAIGE happens to be the acronym for the 8 stages. There are 4 I's. Want to take a shot at this? BAIIIIGE, 8 stages of personality development per Erikson. B,
Oh my god.
basic trust.
Oh yeah, trust versus mistrust. Yeah.
A,
Autonomy.
That's
versus
funny.
shame and
perfect.
Yeah. Oh
Now here come the I's, all right?
god.
You don't have to get them in order.
Okay.
It's like one's like
Initiative versus guilt.
Good, initiative, good.
Identity.
Identity, good.
like intellectual. No.
Now initiative you nailed, that's actually the 3rd stage.
Oh,
Integrity.
integrity versus shame and doubt.
That's the.
Ver- Keep integrity in the back of your mind, not yet.
Oh, like finding love. What's that one?
Intimacy.
Good,
Intimacy.
good. Young adulthood, good. And you got adolescent already, identity. You're just missing industry,
Oh right.
right? So that's good. Good. Initiative, industry, identity,
Intimacy.
and intimacy. Good. That's going to take us to middle adulthood, G.
Generativity.
Perfect. And now Vera, older adulthood.
Despair.
Integrity versus despair.
Good. Ego integrity
Ego.
versus despair. Despair, she's depressed.
Right.
Right? So what is ego integrity? And how might that have been represented in Dolores Claiborne, the film?
Maybe like dying in a way that you feel you should be dying. Like for example, if she had OCPD, she's not able to like live the kind of life that she wants.
With dignity.
Yeah.
And upon, as you're facing death, having the realization that you have left your fingerprints on this world. Right? So what happens here? Can you formulate the death of Vera from this perspective?
She have any kids?
So she left her own money to
Right.
Dolores.
I mean, like her only. She kind of created all these like. She threw all these parties and had all these like events and stuff, but she never formed any lasting relationships except for Dolores. So that's kind of like she feels like she didn't leave a mark besides this one woman.
Until?
Until she sort of helped Dolores like get rid of her husband.
And?
And
How
then
did
she started needing help from Dolores.
Yeah.
She like declined.
And what sets everything in motion to ensure that Dolores becomes who Dolores needs to become and reconciles with her daughter?
She like, makes her dependent on her. Like they're like codependent kind of.
In the beginning, yeah.
Oh, she asks her to kill her. Like she asks.
Oh.
I mean, this whole thing doesn't start until she dies. Because it's only then that there's an investigation. And that investigation is going to bring Selena home. Vera knows this. I'm not so sure. I think she's in despair. I think she may even be depressed, per Erik Erikson. But I think she resolves that with the resolution of ego integrity, knowing that in my death, I will set forward a series of events that allows Dolores to become the woman that she needs to be, including a mother to her daughter. Okay? So I'm not so sure that we're dealing with dementia or true major depressive disorder with a suicide attempt. I think the suicide attempt is actually something that is contemplated, but I think it actually has a very functional reason. She's ready to move on. She's reached her ego integrity and knows that in death, Dolores will be reborn. Something to consider. At least it makes us review the 8 stages. And by the way, how long has she known Dolores? She knows Dolores for a while. What was the symbolism that we had discussed yesterday with the 8 in terms of her relationship with Dolores?
Right, so it represents the 8 stages. That's how long she worked there.
That's how long she did work with her. Sorry, I was wrong. So she actually worked with Vera 8 years. The exact number of that exact number of the publication of Eric Erikson. That's just an irony. That's a coincidence, but
8 years before she had her try to kill her husband? Oh, okay.
anything else from CABnormal / Dolores Claiborne? Questions? All right, stop it here.